Good afternoon. I'm going to call to order this meeting of the Health, Environment, and Community Engagement Committee. I'm Chair of the committee, Dan Gordon, and today I'm joined by Council members Elizabeth Glidden, Andrew Johnson, Lisa Bender, and Jacob Fry. We're a quorum of the committee. We can conduct our business. We have 3 items today on our agenda. First 2 are consent items, and the second is a discussion item about the 2015 Language Access Plan. First, I'll move the 2 consent items. The first one is a master contract for Health and Human Services, authorizing execution of master contracts with eligible providers of community nonprofit agencies and governmental and political subdivision entities. The second item is authorizing an agreement with Metropolitan Health Plan, a health maintenance organization certified by the state of Minnesota, to allow the school-based clinics to be a participating provider of medically necessary services billable to MHP. Is there any discussion on those 2 consent items? Seeing none, all those in favor, please say aye. Aye. Any opposed? Those pass then. And that will bring us to our discussion item, which is our language access plan. And I believe Mr. Rubidor is going to start the presentation. Good afternoon.
Chair Gordon and committee members, good afternoon. I'm David Rubidor, Director of the Neighborhood and Community Relations Department with the City of Minneapolis. And I am up here just to do a quick introduction, and then I'm going to hand over this presentation, if I may, to Nick No and Ayanna Kennerly with staff at the NCR department, as they have been spending probably about 11 months now on a revision of what was formerly known as our Limited English Proficiency Plan, now called the Language Access Plan, and they'll walk you through a detailed presentation about what the new plan contains. But today, specifically, the motion before you, or the recommendation before you, is to approve the 2015 Language Access Plan, consisting of policies and procedures on implementing language services to engage and communicate with residents with limited English proficiency. If adopted, this plan would become effective January 1st, 2016. The one thing, just kind of to help frame this up also, is that this year we're calling it the Language Access Plan. The previous plan that the city was operating under was adopted in 2004. It was called the Limited English Proficiency Plan. The Limited English Proficiency Plan is a federally mandated plan that has federal requirements on providing accessibility to non-English speaking residents. The 2015 Language Access Plan contains all of the components of what's called the Limited English Proficiency Plan, but it also contains a few other things that the city goes above and beyond the federal requirement in order to provide services to non-English speaking residents, and therefore we called it the Language Access Plan. So just to be clear, that Language Access Plan is broader. Limited English Proficiency is a component within this plan. Nick and Ayanna will explain that a little bit more in detail as we go forward. In today's presentation, they will go over the language access components, identifying primary languages, notices, interpreting and translation services that we have, and also hiring procedures. We will also discuss the enterprise language service model and how that operates, as well as the updates to the plan from the 2004 adopted plan and the changes that are being included. And then one other thing that I just want to highlight before I hand it over to the 2 other staff is the Language Access Plan is really about achieving the One Minneapolis goal. As much as this is a federal requirement, and this plan actually meets the federal mandated requirements for this type of work, it is really about making sure that all of our residents have access to our services and programs. And this plan specifically dealing with the non-English speaking residents of our city to be able to access these services. So it is a vital piece to achieving our One Minneapolis goal. With that, Chair Gordon, if I may, hand it over to the other staff.
Absolutely. Thank you very much.
Thank you.
Oh, thank you.
Sure. Good afternoon. My name is Nick No, and I'm an administrative analyst with the Neighborhood and Community Relations Department. Chair Gordon, community members. Today, I'm just going to primarily gloss over what our process was in updating the plan as well as where it derived from. So the first component is actually the federal mandates of our language access plan, or formerly known as the Limited English Proficiency Plan. The foundation of this plan actually stemmed from two federal mandates. One, the Civil Rights Act, which is prohibiting discrimination against people based off of national origin as well as color, and then further later on the Executive Order 13166 of 2000 to prohibit discrimination based off of language. So under NCR, we manage these two federal mandates. What we do is we actually provide consulting as well as management of our language services here in the city. And next slide. So as Director Rubidor has mentioned, the former plan, the LEP plan, actually had the limited English proficiency components, which actually covers providing notices to residents to say this is how you gather and provide the gather and ask for translation and interpreting services, as well as stating that vital documents are to be translated in our primary languages, which is also an additional part of the LEP plan in terms of identifying the primary languages for which the city will provide alternative services to. What we did was we actually took the LEP plan and re-engaged staff to figure out what are the deficiencies and areas which we can improve upon for the language access plan, and going above and beyond the federal requirements. And this is to actually have the outcome of making sure that we provide adequate information to limited English proficient residents, as well as for them to understand and access the services that we provide here as a city. So at this point, Ayana will actually go over what our language services in the city is, as well as how we deliver them.
Good afternoon. My name is Ayana Kennerly, and I'm the African American Community Specialist for NCR. And I also manage our language services here at the city. So any translation or interpretation services go directly through me. So Minneapolis LEP populations. So an LEP individual is a person who has non to limited proficiency in the English language. And the LEP populations in Minneapolis are actually calculated by Minneapolis Public Schools. And they pull their data once a year, typically around the winter. So from the data that they pull, you can see the primary languages other than English are listed below. And the top three are Spanish, Hmong, and Somali. So language service infrastructure. This particular slide shows you the process in which departments actually contact me to carry out their services. So you can see in the blue, there's a department that would first contact NCR, and again, they would work directly with me. And so we would talk through whether they need translations, interpretations, support from NCR, or a combination of those three things. Then there's an arrow that points downward. And so at that point, I would contact one of our vendors. We have roughly 5 that we work with. And if translations is the need for the department, I would put in that request to the vendor, and then they would complete the request. So from that point, then I would work with my colleagues from the Access and Outreach team who speak Hmong, Spanish, and Somali to do a quality assurance check. And the reason why we do that is to make sure that anything that is translated actually matches the intended language, or the intended intent that we have in English. So once that's done, then we would send it back over to the department, and then they would send it to their intended audience, residents, departments, whoever it's intended to go for. So this slide, enterprise language expenditures, actually shows the total cost that we spent in 2014 for translations and interpretations. And you can see the total is just over $73,000. And at the bottom, you see that it says NCR manages a majority of the city's language contracts. So you can see in purple that NCR spent just over $28,000 on translations and interpretations. And there actually are a few departments here in the enterprise that do manage their own. So for example, 311, City Council, the Health Department, and Police Department do manage their own. And then if you look just over to the right in green, you can see that the other section is broken down by the departments who do or who have spent money on translations and interpretations, but not as significant as some of the other departments over there. So the next slide, contracted language services expenditure. So this actually breaks down the cost from 2010 to 2014. So for 2010, you can see that we spent $19,966 as an enterprise. And then in 2011, that went up to just over $25,000. So just in a year, that went up just about $7,000. And so the interesting thing for me about this slide is that within those 4 years, we've increased interpretation and translation spending for anywhere between $5,000 to $20,000. And for me, I think it's significant because it tells me that we're doing a better job of making sure that LEP services are provided and we're doing equal access for all residents here. And it also suggests that as a department, NCR, we're doing a much better job of making sure all other departments are aware of the services we can help them provide to residents. So I found that really interesting. And then language line calls. So this particular slide breaks down the calls that we received in the language line. And the language line is a phone interpreting service for LEP residents. So in total, we had 2,409 calls for 2014. And as you can see, the vast majority of those calls are from Spanish speakers with 79%. And then there's Somali with 13%, Hmong 5%, other 2%, and then 1% is Oromo.
So I'll be providing the update the information about how we updated the plan within the last 11 months. And to reiterate what Director Rubidor and I said earlier is that the language access plan is really a guide for city staff as well as departments and council members to engaging residents who have or limited or no English speaking proficiency here. The plan in itself has our previous plan actually met the federal requirements and was very compliant, and we actually took this on ourselves to make sure that we provide a better and more efficient model to bring easier access to residents with limited English speaking proficiency. So what we did for the update was we convened what we call the Accessibility Liaison Network, and this is formerly known as the Limited English Proficiency Liaison Network. This network is made up of representatives from every department. And what we did was we convened them to explain to them what the LEP plan formally is, and then how we wanted to provide the update. And from there, we actually met with several different departments about what their procedures and policies are and in their operations to working and engaging residents, and where people with limited English proficiency falls under that, figuring out what we need to do better in providing these language services to them, as well as what's the more equitable manner to do so. From there, we met with program and managers and staff to see what is a better system in terms of engaging residents. And then that actually is the crux of our plan in terms of what the process and procedures are for accessing language services. And we brought this back to the city attorney's office to make sure that it still met the federal requirements. And we received that our language access plan met the LEP requirements and components, and then the city attorney's opinion that was issued in 2004 still applies to our 2015 plan today. So in addition to reviewing what our process is, we updated the vital programs and services list in identifying where engaging residents or where residents engage with us or interact with our programs and services fall along, and then what we need to do proactively to provide language services. So this could actually mean having interpreting and translation services ready, but not immediately do so, but upon request that we can provide those services to them for them to access and understand what the service delivery is. So the updates to the actual plan in itself is the notice of rights. We have what was formerly known as a language block. We're calling it the accessibility block now to identify that on our information or any mailers or letters that are going out, identifying departments or a contact for whether if a resident has a question or is in need to better have understanding of what the information is, they could request those services either in a different language as well as any accommodations along with disabilities. But the accessibility block is a way for them to identify who to contact and to request those services or to better understand the information that was sent out to them. And then the crux of the update was with our translation and interpretation services to identify that NCR is the one that manages the contracts, and that the best mechanisms to contact us, and then as Ayana has mentioned, how to do, which services to utilize to best engage the resident. And then in our conversation with department staff, we found that there needed to be better protocol for at service or more direct service staff on the ground to engage residents, because a lot of the interpreting and translation work actually takes some time to request and reserve. So we built in protocols that would be utilized by staff to communicate with residents on the spot. So for more immediate interaction, so such as utilizing our phone interpretation services, so that way that they could either best communicate with the resident or to schedule a meeting time later on where we could assist them with providing an in-person interpreter as well. Additionally, provided to our language access plan are updated sections by human resources for hiring multilingual or bilingual staff. And additionally, as I mentioned before, updating our list of services, programs, and activities that are utilized by LEP residents. And then we changed the plan where we would like to update it or revisit it every 2 years to make sure that the primary languages are still relevant, as well as having an implementation timeline to monitor what the language services utilized under the city and enterprise is. So the new policies that we incorporated in this plan is actually one for technology-based programs. In our conversation, we found that a lot of staff would like to utilize programs such as Google Translate. However, programs such as Google Translate is only 80% accurate. So when we have a situation where they're trying to provide information that may have a fiscal implication on the resident, or if it's a change in service delivery, they cannot best communicate with that resident. So we would like to implement that policy to say that utilizing technology-based programs would not be sufficient in communicating with them when it comes to an official enterprise service or program delivery. Additionally, one of the larger added components is about boards and commissions. In this plan, we stated that boards and commissions will operate in English. However, when an appointed member requests for language services, such as an interpreter or translation services, the staff that's supporting that board and commission would provide that service to them. So they would work with actually NCR to figure out how to best schedule the interpreter, as well as which documents or information should be translated to best uphold their roles and responsibilities as an appointed member to that board and commission. In doing this, we actually engaged the staff that supports boards and commissions to assure them that the information and protocols that we set in place would best suit them, and that they could always contact us for consultation.
Could you just give an example of an interaction with financial implications or service delivery changes where
Sure thing.
The technology-based wouldn't be
Yes.
useful?
In our conversation, we actually talked with numerous departments, such as the city assessor's office, who has a city assessors going out to the property to speak with residents, as well as staff at the Minneapolis department review, where we have staff from both, I believe, the health department, CPED, and regulatory services, who provides information to residents. And they do, upon immediate questions or concerns, they don't have the time to request interpreters to come and provide that service or communications. So we identified that utilizing phone interpreting services at that time would be the best case, or utilizing a bilingual staff. So those are more of the situations where it's immediate or direct service staff that are out in the field. I believe other examples could be with health inspectors that go and review, go to, let's say, a bilingual or non-English restaurant that does inspections. So in those scenarios, that's where as I mentioned before, the gaps in the previous plan and this plan were identified.
Yeah. Thank you.
So that actually concludes our presentation. Again, we would like to approve the 2015 Language Access Plan and then to have it ready to be rolled out for the 1st of January 2016. We have a rollout and implementation plan, and to re-engage departments to make sure that we provide them with the necessary resources to communicate and engage non-English speaking residents. Are there any questions?
Okay, thank you very much. I believe there are some questions. Councilmember Glidden.
Thank you, Mr. Chair, and thanks for the presentation. I know this has been a long time in the making to update our policies and make sure we have a good plan for having all of the city read from the same playbook, so to speak. I had a couple of questions, and these are really, I think, kind of post-rolling this out type of questions, and maybe these are just either food for thought, or maybe this is an opportunity for you to share how you think that the department may keep track of compliance with the language with the LEP plan. But I was curious whether you or the coordinator's office was thinking of developing any metrics around this plan and how it is being utilized. I know you had on your slide the increase in use of language services of different types. I'll just say, and I don't know how much digging in there was to identify why that was. I can sort of brainstorm, I guess, myself why I think that is from a variety of reasons, including just departments changing the way that they do business and how much they see this now as an important part of connecting with the communities they serve. But could be many other reasons as well. So I think these are in-demand services that will continue to be even more in-demand. And so I'm curious how you're thinking of tracking either use of services, also tracking on an ongoing basis compliance with the plan, if there are any things that you feel are important to track that compliance. I know you also said there were some departments that you worked with more hands-on with than others. I wasn't sure what was the case for that. As an example, I think I can just go contract with whoever I want, frankly. I don't think that, and it wouldn't necessarily be someone who meets the requirements for providing the type of translation that we want to make sure is provided. And so that's what I say when I mean compliance, that, when you have contracts for a small amount, we don't have the same kind of checks and balances on those as we do for other contracts. So those are some of the questions that I had, and I didn't know if you had thoughts you wanted to share right now, or if these are more food for thought for later.
Sure. Jared Gordon and Committee Vice President Glidden, we actually do have a plan to monitor language services for the next 2 years. One of them, as you mentioned, in terms of metrics, we will be working with not only the departments that utilizes our contracted services, but we're requesting that other departments who have their own language services as well provide data to us so that we can figure out how much they spend on interpreting and translation services for which languages, and then as well as the duration for both interpreting and translation services. Under that, we would like to understand that not only the qualitative data behind that, but the quantitative data, and whether those services are best effectively used, for lack of a better term. Part of our work for the next year is actually identifying which of our contracts are best effective in providing these services, so that way we could have more cultural context and relevant information when we provide interpreting and translation services to residents. So in addition to that, we will be compiling a lot of data around what the language used are, and then as well as what's the best, formats for interpreting as well as translation services moving out from this point forward. So we will be monitoring very closely which departments best uses this. Does that help answer your question?
Yeah. It does. Thank you very much.
So I have a question in terms of who is the point person, or who is the person that city departments would go to, or if a citizen might go to somebody thinking, oh, we're not actually providing access in the format that I need.
Sure.
Who's the point person?
Sure. Under the plan, under the plan, it actually identifies NCR as the department that manages the federal mandated components of the LEP as well as Title VI. However, the Access and Outreach Manager, which is currently vacant, but Director Rubador is in the process of hiring, is the person that actually manages this plan as well as working with city departments and staff to provide these services and for residents to come in and if there's any, complaints or issues to provide that to us, as well as the ANO, the Access and Outreach Division of NCR, such as myself and Ayana, will be working closely with the ANO manager to make sure that these services are best delivered.
So we'll have to make sure everybody knows who that Access and Outreach Manager is once they're hired, and then that's the person that we'll go to. And I know that I've gotten questions in the past also and about that block of text that we're supposed to include on all our notices. And are we clear now on what that block of text should say and everything? And all the departments know what that is as well?
Chair Gordon, yes. We have actually talked with a lot of departments about what the best use of that accessibility block would look like. We've done a lot of revision to it this year, and then we will provide a few more updates to it within the next year as well to best fit the format of actually the information that we're sending out. We understand that certain materials require longer text and shorter text depending on what the information is. So we're working closely with departments that manages their operations and information to assure that that block best fits their needs and use, and for residents to utilize it to contact not only the department but as well as the city for any additional information or accommodation.
And then I had another question about the website and other documents that we have. I'm concerned the meeting agendas, meeting notes, everything that the clerk's office is posting is accessible to everybody who needs it in the format that they need. And is that happening now? I know even when I've, for example, in terms of formats, when we go and present to the committee, people with disabilities, that certain there's certain limitations or restrictions that they may have in terms of how they can get information as well as in alternative languages. And if we solve that problem in terms of going to our website and being able to grab a document so that somebody, even with what they have on their own computer at home, can have that translated or put into audio, for example, or enlarged?
Jared Gordon, we actually talked with IT about that. For the time being, we utilize Google Translate to provide alternative languages, our information in alternative languages. However, we do note that when they click on Google Translate, they're leaving the city's website. So that is actually out of our domain, and that the information would not be best accurately translated. But upon that, with the block in itself, as well as other information on our city's website, we identified that if a resident would like that information in a different format or language, that they could contact the department that's managing that information to have that information translated or provided to them in an alternative language. Depending on which department and program it is, some departments provide that alternative language or information already on their website, while others operate off of a request-based system where if a resident needs that information in a different language, then they can call that the department and they will then provide the information to them in a different language. Does that best help answer your question?
Yeah, I think so. I also think there was some concerns about PDFs and how the information was stored and how sometimes it was completely unworkable for folks. So maybe Mr. Rubador.
Chair Gordon and committee members, I figured I'd jump up and interject here. As you're alluding to here, the limited English proficiency or the language access plan that we're talking about today and the work around the ADA, the Americans with Disabilities Act, clearly intersect in many, many different ways. And so today what you're seeing is around the limited English proficiency aspect. We are nearing completion of our ADA assessment of programs and services. And website and the IT kind of interface with the public is a significant part of that discussion. And we will be bringing to the council in about 2 to 3 months of a transition plan that's coming out of those discussions that will address a number of these issues that you're bringing forward regarding ADA. Initially, we had thought we'd bring these both at the same time, but the ADA is going to take a little bit longer to sort through some of the recommendations and the implementation plan.
Okay, appreciate that. Sorry I confused the two that I may have. I'm not seeing any other questions. I really appreciate this coming forward in this work. I think one thing that it's maybe demonstrating is that we're going to have more need and demand for translations. And Councilmember Glidden also referenced the bar graph that you showed, how it's increasing. I do worry sometimes that if the cost of the translation falls on the departments, that they're going to start making the judgment that maybe it isn't as necessary as it should be. So I think we have to keep that in mind as a council. I think there also will come a time when we'll probably need to be more interested in having bilingual staff who can do translation services available within various departments, even expertise in zoning or in building codes and all of that, but then with that expertise as well as the language expertise that we need. And I know there's discussions underway about how to do that and how to compensate, and HR is looking into that. I saw in the plan, and I appreciate that as well. So I think I will just move approval of this, seeing no other questions. All those in favor say aye.
Aye.
Any opposed? All right. With that motion carries, and I think our meeting is adjourned. We have no further business before us, and thank you all very much.
Thank you.